Welcome to Lesson 1.3 of the MoCA Prep course. Now that you've learned what the MoCA is and why it's used, it's time to focus on a crucial question for real-world practice and exams. Who exactly takes the MoCA? Understanding the types of patients and the settings in which the MoCA is administered is essential. Whether you're preparing to give the test, analyze the results, or recognize when it's appropriate to use. This knowledge directly influences how the test is delivered, interpreted, and scored. Let's break it down. Key patient populations who take the MoCA. The MoCA is used to screen a variety of individuals, not just elderly adults. Here's a breakdown of specific patient populations where the MoCA is commonly used. These groups frequently appear in clinical training scenarios and testing materials. 1. Older adults ages 65 and up. This is the most commonly tested group associated with MoCA. Many older adults may experience normal age-related cognitive slowing, but the MoCA helps detect abnormal decline early. Why tested? Early detection of mild cognitive impairment, MCI, or Alzheimer's, routine cognitive screening during annual health visits, monitoring cognition in those with existing memory concerns, testable tip. Patients without complaints may still be screened as part of baseline cognitive assessments. 2. Stroke survivors patients. Recovering from stroke often experience impairments in attention, language, and executive function. The MoCA is especially useful because it includes tasks sensitive to these deficits. Why tested? Evaluate post-stroke cognitive functioning, plan rehabilitation goals, monitor cognitive changes over time. Testable tip. The visuospatial and executive sections are particularly important in this group. 3. People with Parkinson's disease. Cognitive symptoms can appear early in Parkinson's, even before motor decline becomes severe. Why tested? MoCA detects early executive and memory deficits, useful in both early stage and advanced Parkinson's. Testable tip. MoCA is more sensitive than other cognitive tests in this group, often emphasized in exams. 4. Individuals with depression or psychiatric conditions. Sometimes cognitive symptoms are caused by mental health disorders rather than neurodegenerative disease. The MoCA helps distinguish between psychiatric and neurological causes. Why tested? Rule out underlying dementia versus depression-related cognitive impairment. Support referral to appropriate services. Testable tip. Test results may reflect attention or memory challenges, but interpretation must consider emotional and psychological context. 5. Patients with traumatic brain injury, TBI. Mild or moderate head injuries can affect memory, focus, and planning. Why tested? Assess recovery progress. Identify specific areas of cognitive weakness post-injury. Testable tip. Delayed recall and abstraction tasks often highlight difficulties in TBI patients. Common settings where the MoCA is administered. The MoCA can be administered in many different environments, and each setting can influence how the test is given and scored. Here's what test takers should know. 1. Primary care clinics. Physicians may use the MoCA during routine visits if there are memory complaints or behavioral concerns. Often the first point of cognitive screening. 2. Neurology clinics. Used as part of comprehensive neurological evaluations for dementia, Parkinson's, MS, and more. Usually administered alongside imaging or neuropsychological testing. 3. Geriatric clinics and memory centers, focused entirely on aging adults and memory disorders. Results here may guide medication management or living arrangement decisions. 4. Rehabilitation facilities, used for patients recovering from injury, illness, or surgery that may impact brain function. Helps identify cognitive barriers to physical recovery. 5. Hospitals and emergency departments. Sometimes used during admissions or discharge planning, especially in older patients or those with confusion. May prompt further inpatient assessment or urgent referrals. 6. Home visits or telehealth. With rising use of telemedicine, the MoCA is now adapted for remote administration in select cases. Still standardized, but requires training to maintain test validity in remote environments. MoCA, used based on risk factors. It's not just age that determines whether someone takes the MoCA. Watch for these clinical red flags. They're often used in questions or scenarios to determine if MoCA should be administered. Reports of forgetfulness or misplacing items, difficulty following conversations or instructions, poor performance in daily tasks like cooking or finances, repeating questions often, confusion about time or place, sudden changes in personality or judgment, even subtle signs, if consistent, can warrant testing. A MoCA should be considered whenever cognitive changes affect daily living, even without a formal diagnosis. Lesson recap: who takes the MoCA? In this lesson, we explored patient populations who commonly take the MoCA, including older adults, stroke survivors, Parkinson's patients, people with psychiatric disorders, and individuals with TBI. Settings where MoCA is administered: clinics, hospitals, rehab centers, and even homes. Red flags that signal the need for cognitive screening using MoCA. This knowledge is critical for both administering the test and interpreting results in context. Every MoCA score tells a story, but to understand it fully, you must first know who the test is for and why it's being used.